Edta tubes, commonly known as Edta tubes, ethylene diamine tetraesteric acid. They are commonly used for estimation of complete blood count, hematocrit, hemoglobin, for making blood films, blood groupings, blood compatibility testing, forward blood groupings and cross match, direct Coombs testing, blood screening or serology for estimation of reticulocyte counts, HbA1c, blood urea nitrogen, bone marrow specimens, or hemoglobin electrophoresis. Mode of action of Edta is it prevents coagulation by binding calcium, which is essential for clotting mechanism. Edta is well-known anticoagulant since early 1950s. A pure grade of Edta additives helps as a best anticoagulation. Concentration of K3 Edta is 1.7 plus minus 0.2 milligram per milliliter of blood. The top color of the vacuum is purple. It is recommended anticoagulant for routine hematological investigations. Disodium and dipotassium salts of Edta are commonly used. The dipotassium salts is preferred because it's more soluble compared to disodium salts. Now tripotassium salts is more preferred. Edta is a tube coated with spray-dried K2 Edta on its inner wall. K3 Edta is a liquid and will dilute the sample. K2 Edta is a spray-dried on the walls of the tube and will not dilute the sample. Both dipotassium and tripotassium ethylene diamine tetraesteric acid are widely used anticoagulants. International Council Standardization of Hematology (ICSH) and several researchers recommended the use of K2 Edta due to its less hyperosmolar effect on blood cells compared to K3 Edta. The alternative to Edta is sodium citrate and heparin anticoagulants. Edta tubes have a fill line printed on them and should not be overfilled, as this can lead to the formation of clots within the sample, which invalidates the majority of hematology tests. So appropriate sample collection technique must be applied and be cautious. Note: after the tube has been filled with blood, immediately invert the tube 8 to 10 times to mix and ensure adequate anticoagulation of the specimen. Edta tubes are used for direct sampling analysis since erythrocytes, leukocytes, and platelets are stable in Edta anticoagulated blood for 24 hours. Edta is the standard anticoagulant used in the complete blood counts and in the blood banks.